Hello everyone, my name is Saroj Bhangade. Today date is the 1st April 2022. Today video topic is the circulatory system. The circulatory system consists of a network of arteries, veins, capillaries with the heart of pumping blood through. It is a primary role. It is a provide essential nutrient, minerals, and hormones to the various part of the body. Alternately, the circulatory system is also responsible for the collecting the metabolic waste and toxin from the cell and tissues to be purified or expelled from the body. The features of the circulatory system. The first is that the human circulatory system consists of the blood vessel and lymph. The human circulatory system circulate the blood through the two loops, double circulation, one for the oxygenated blood and another is the deoxygenated blood. The human heart consists for the four chamber, two ventricle or two ventricles. The human circulatory system poses the body-wise the network of blood vessel. These comprise arterioles, vein, and capillaries. The primary function of the blood vessel is to be the transport the oxygenated blood and nutrient to the all part of the body, and it is also tasked with the collecting the metabolic waste to be expelled from the body. The most circulatory system diagram do not visually represented in shear length. Theoretically, if the vein, arteries, and capillaries of the human wear out end to end. The organ of circulatory system. The the organ of circulatory system. The human circulatory system comprises the four main organs that have specific role and function. The vital circulatory system organ include: first is the heart, second is the blood, third is the blood vessel, and fourth is the lymphatic system. So first is the heart. Heart is a muscular organ located in the chest cavity, right between the lung, and it is the position slightly toward the left thoracic region, and it is involve the pericardium. The human heart is separated into the four chamber, namely the two upper chamber called atria and two lower chamber called the ventricle. So through the animal possess a heart, the way of their circulatory system function is quite different from the human. Moreover, in some cases, the human circulatory system is a much more evolved when the compare the insect. The double circulation, the way of flow in the human body is unique, and it is quite efficient too. The blood circulate through the heart twice, hence it is called as the double circulation. So second is the blood is a fluid connective tissue, and it is a form a vital part of the human circulatory system, and it is the main function is to the circulate nutrients, hormones, minerals, and other essential components to the different part of the body. The blood flow through the specified set of the pathway is called as a blood vessel. The organ which is involved in the pumping blood to the different body part is the heart, and the blood vessel, blood plasma, protein, and other mineral components such as the sodium, potassium, and calcium constitute the human blood. The blood is composed of the plasma. The plasma is the fluid part of the blood, and it is composed by the 90% of the water. And second is the red blood cell, white blood cell, and platelets constitute the solid part of the blood. The type of the blood cell. The first is the red blood cell. The red bloods RBC are mainly involved in transporting the oxygen, nutrient, and other substance to various part of the body. And second is the white blood cell, WBC. White blood cell are specialized cell which is the function which is a function of the body defense the system. They provide the immunity by the fending of the pathogen and a harmful microorganism. Third is the platelets. Platelets are the cell that help to form the clots and stop bleeding. They act on the site of injury or wound. Next is the blood vessel. The blood vessel are the network of pathway through the which of the travel throughout the body, and arteries and veins are the two primary type of the blood vessel. So first is the arteries. Arteries are the blood vessel that the transport oxygenated blood from the heart to the various part of the body. They are thick, elastic, and divided into small network of blood vessel called the capillaries. Second is the vein. Vein are the blood vessels that carry deoxygenated blood toward the heart from the various part of the body. They are thin, elastic, and present the closer to the surface of the skin. However, the umbilical vein is only vein is the oxygenated blood to the entire the body. Third is the lymphatic system. The human circulatory system consists of the another body fluid called as the lymph. It is also known as the tissue fluid. It is produced by the lymphatic system, which comprise the network, the interconnected organ and node and duct. The lymph is a colorless fluid consisting of the salt, protein, water, which is a transport and circulate the digested food and absorb the intracellular space of the tissue. Unlike the circulatory system space the tissue, unlike the circulatory system, lymph is not pumped. Instead, it is a passively flow through the network of the vessel. So next is the function of the circulatory system. The most important function of the circulatory system is transporting oxygen throughout the body. One another the vital function of the human circulatory system. First is a help is a sustaining all the organ system. Second is a transport the blood, nutrient, oxygen, carbon dioxide, and hormones throughout the body. Third is it is a protect cell from the pathogen. And fourth is it is a act the interface for the cell to cell interaction. And fifth is the substance present in the blood help the repair the damaged tissue. And antihypertensive drug. The hypertensive are the class of the drug that are the used to treat the hypertension. Antihypertensive therapy seek to prevent the complication of the blood pressure such as the stroke and myocardial infarction. The evidence suggests the reduction of the blood pressure by the 5 mm HD can be decreased the risk of the stroke by the 34% of the heart disease and reduce the likelihood dementia, heart failure, and motility from the cardiovascular disease. So the several classes of the antihypertensive difference in the side effect profile, ability to prevent the endpoint, and the cost. The choice of more expensive agent whenever the cheaper ones would be equally effective may be negative impact of the national healthcare budget. So first is the diuretics. The diuretics help the kidney eliminate excess the salt and water from the body tissue and the blood. So next is the calcium channel blockers. The calcium channel blockers block the entry of the calcium into the muscle cell in the artery wall. Third is a ACE inhibitor. The ACE inhibitor is a ACE inhibitor inhibit the activity of angiotensin converting enzyme. The enzyme responsible for of the conversion of the anti-tension first and anti-tension second a potential vasoconstriction. The fourth is the antigen receptor and receptor antigenes. Work by the antigenes, the activation of the anti-tension receptor. The fifth is the androgenic receptor antagonist. The the and fourth is a vasodilators are the directly on the smooth muscle of the arteries to relax their wall, so blood can be move more easily through them. They are the only used in the hypertensive emergencies. So next is a renin inhibitor. So renin come one of the level higher anticoagulation converting the enzyme in the resin inhibitor can be therefore effectively reduce the hypertension and approved by the US. The FDA in the treatment the FDA for the treatment of the hypertension. Next is a androstenedione receptor antagonists are the androstenedione receptor antagonists are not recommended as a first line agent for the blood pressure, but are both used in the treatment of the heart failure and the resistance of the hypertension. Next is alpha 2 androgenic receptor. Again the central alpha antagonist lower blood pressure by the stimulating the alpha receptor in the brain, which is the open peripheral arteries, easing the blood flow. This alpha 2 receptor are known as the autoreceptor, which is provide the negative feedback in the neurotransmission. So next is a bosine endothelium receptor blocker. Bostin belong to the new class of the drug and work by the blocking endothelium receptor. It is specifically indicated only the treatment of the pulmonary arteries hypertension in the patient with the moderate to the severe heart failure. The choice of next is the choice of the medication for the mild blood pressure evolution consists of the guideline called the medically supervise the lifestyle change and observation before this recommended drug therapy, and this is the antihypertensive drug. Thank you.